Yes, I am Dr. David. To continue with the modules, this is going to be the second module on the health system management, and the topic we're going to consider is strategies for maintaining health. Strategies for maintaining health. Achieving health and remain healthy is an ongoing process. To achieve health is an ongoing process. Ongoing process in the sense that it's a continuous process. These are processes that you need to do, maintain it. You need to follow those strategies one after the other for you to maintain good health. Effective strategies for staying healthy and improving one's health include the following elements. Number 1, the social activity. Number 2, sports and nutrition. Number 3, hygiene. Number 4, stress management. Number 5, healthcare. Number 6, workplace wellness program. And number 7, public health. These are the strategies for maintaining health. We're going to take it one after the other. So the first one is social activities. Social activities. Personal health depends partially on the social structures of one's life. The maintenance of strong social relationship is linked to number 1, good health condition. Number 2, longevity. Number 3, productivity. Number 4, a positive attitude. This is due to the fact that the positive social interaction as fueled by the participants increases many chemical levels in the brain, which are linked to personality and intelligence traits. When we talk of social activities, to maintain it, it is linked to good health condition, it leads to longevity of life, leads to productivity in your work and even in one's day-to-day activities, and it also links to a positive attitude. When there's positive social interaction, then there will be increase in chemical levels in the brain of the individual, and this is linked to personality and intelligence traits. Now, we have nutrition as number 2, and sports and nutrition. So sport goes along with nutrition. It means when you eat good food, then you need to do exercise. Sport nutrition focuses on the link between dietary supplements and athletic performance. So it stands between the needs or focuses on between the needs. Focus on the need between dietary supplements and athletic performance. One goal of sport nutrition is to maintain glycogen levels and prevent glycogen depletion. So one of the major reasons for or goals for sport and nutrition is to maintain glycogen level and prevent glycogen depletion. So when there's excess glucose, the glucose stays stored in form of glycogen in the body, and when the excess glucose is stored as glycogen. Now, when the present glucose is used, then the stored glucose will be needed and the body will now convert the excess, the stored glycogen now to glucose for the body use. So what does that is the sport exercise will help you burn the energy, and then nutrition will replace the lost glucose. So it helps you or help the body to maintain glycogen levels and prevent glycogen depletion. And that is to optimize energy levels in the muscle tone. So the sport and nutrition, another thing that they do is they help us optimize energy levels and help us to maintain the muscle tone. Not only that, we need to know that there are things or the ways let me say that there are things we need to do when it comes to issue of nutrition and sport. Now, an athlete's strategy for winning an event may include a schedule for the entire system of what to eat, when to eat, and in what precise quantity. Now, what I'm saying here is this, that when you want to, when you look at exercise and you look at nutrition, so you look at, okay, when you want to do a particular exercise, what type of food do you need to do? Do you need to eat? And when it is another one, what type of food do you need to eat? So it means that you need to take into consideration what to eat, the quantity to eat, and when. Is it before, during, or after, or between workouts, or between an effect? Now, you want to look at it. If that is taken into consideration, then you'll be able to balance up between sport and nutrition. So when you're supposed to eat every food, you eat it. When you don't supposed to eat every food, then you don't eat it. So that is sport and nutrition. Number 3, hygiene. And hygiene, we mean to say that hygiene is a practice of keeping the body clean to prevent infections and illness. You keep the body clean. Yes, the next one is hygiene is the avoidance of contact with infectious agents. It is the avoidance of contact with infectious agents. That means when you avoid having a contact with infectious agents. Now, the next one is hygiene practices include bathing, brushing and flushing teeth, washing hands especially before eating, washing food before it is eaten, cleaning food preparations, utensils, and surface before and after preparing meals, and many others. This may help prevent infections and illness. So when it comes to hygiene, you wash your plates, wash your teeth, wash your body. You make what is without, as in you make clean everything that you want to put into your mouth, and everything that have to do with your body and your environment. So by cleaning the body, dead skin cells are washed away with the germs, reducing their chance of entering the body. You agree with me that when you clean yourself or clean your body, you are removing or washing away germs, and then you reduce the chance of, reducing the chance of entering into, chance for those germs to, prevent the germs from entering into your body system. The next thing is stress management. That's number 4. Prolonged psychological stress may negatively impact health, caused by weakening the immune system and mind. Stress management is the applications of methods to either reduce stress or increase tolerance to stress. So when we talk of stress management, we are talking about what to do to prolong psychological stress. And all these things may negatively impact your health. And that will happen by weakening your immune system. So when there is stress, then your immune system will be weakened, your mind also will be weakened. But for you to manage stress, you either reduce your stress or increase your tolerance to stress. So that you reduce your stress or you increase your tolerance to stress. Now let's look at methods of stress management. We have the first method, which is physical method, and this is relaxation techniques to relieve your stress. So relaxation techniques, you have to relax. That will help you relieve your stress. That is physical method. Then we have the other one, that is psychological method, and this includes number 1, cognitive therapy. Cognitive therapy is a psychological method that will help you reduce your stress. Another thing that you can use is meditation. You meditate on something positive. Then that is positive thinking. That's number 3. That's one work by reducing your response to stress. So when you do all this, then you have your stress managed. Now let's look at healthcare. And we say healthcare, we mean the preventions, the treatment and management of illness. Preventions, treatment and management of illness. And these help you to preserve mental and physical well-being through the service that is offered by medical doctors, by nurses, by community workers, and all allied health professions. That is healthcare. That is healthcare. So let's look at workplace wellness programs. Workplace wellness program is just simply your occupational health. These are things that you do in occupational health. You agree with me that there are things that you do in occupational health. So, and this include workplace wellness programs. Workplace wellness program help in improving employees' health. It helps in improving employees' health. It helps in improving employees' wellness or well-being. It helps improving employees' morale, improving employees' loyalty and productivity. So, workplace wellness really help the employees, and that will help them to have a good productivity. Let's look at some of the wellness programs that can be done. This includes on-site fitness centers. On-site fitness center includes health presentations, like giving of health talks relating to the type of work or occupation of that place of work. Wellness newsletters. Wellness newsletter also is another program that we can do. The access to health coaching. So all staffs needs to have access to their health coaching, as in have access to get answers to all questions related to their health. You can also organize tobacco cessation programs. Tobacco cessation programs also can be organized for the employees in their various places of work. Not only that, training related to nutrition, weight, and stress management. So, training related to nutrition, weight, and stress management also is very, very important part of the wellness program. Then we have other programs which may include health risk assessments, health screening, and body mass index. Mass index monitoring. These are programs that we done at workplace. And let's look at the last one, that's public health. So public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individual. So public health is the science and art of preventing disease. And when you prevent disease, then you prolong life, then you promote health. And this is done through the organized efforts. Organized efforts that we say is talking about the efforts of both the society, organization, public, private, communities, and individual. So it does a joint effort of everybody to make sure that diseases are prevented and lives are prolonged. It is concerned with threats to the overall health of the community based on population health analysis. It is concerned with threats to overall health of a community based on the population health analysis. So we look at things that are really can really endanger the health of a community members, and try as much as possible to analyze it and provide possible solution to the health problem of source population or community. Public health has many subfields, but is typically divided into categories of number 1, epidemiology, biostatistics, health services, environmental health, social and behavioral health, and occupational health. So these are the categories that public health is divided into: epidemiology, biostatistics, health services, environmental health, social and behavioral health, then occupational health. So we also look at public health. The focus of public health interventions is to prevent rather than treat a disease through surveillance of cases and the promotions of health behavior. Treating a disease can be vital to preventing it in others, such as during an outbreak of an infectious disease. Vaccination programs and distributions of condoms are examples of public health measures.